So I wanted to welcome everybody to the Soffer Longevity Podcast. It's our doctor's lounge where we sit and talk about things as if we were at a doctor's lounge and make it interesting, hopefully, for everybody. We have 5 interesting topics coming up today. One is going to be the modern treatment for vitamin deficiencies and what has really changed about that. Another one is going to be this thing in the news about this famous race car driver by the name of Kyle Busch and what was really behind his cause of death that we know about. A third is going to be Inflammaging, which is really the new longevity clock and why that is. We're going to talk about some new cancer immune-related treatments that are out there and what exactly that means for everybody. And we're going to finish up with this newly discovered sleep hack, if you will, called your glymphatics, the lymphatics of the brain and why that's important. So those are going to be the topics to be discussed, as well as just kind of what pops into 2 doctors at the doctor's lounge. So without further ado, I want to both thank our sponsor, Longevity AI, as well as welcome Dr. Safa Maklad, our resident longevity expert, functional medicine expert, and my own personal doctor. So I'm going to start with that. So I'm going to talk about something that we have on my own personal scenario, which is the vitamins that we have been both. You've found that I had a deficiency in that I didn't know, specifically vitamin D. There was a couple of others. And my experience, which was, well, you're low in vitamin D, you need to take some vitamin D. And you gave me a very easy form of it. Maybe you can explain to, first of all, folks, what my kind of levels were and what type you gave me.
Okay. So your levels were actually lower than the cutoff, which, so for the most part, if your level's like at 30 or above, they consider it adequate. But I don't think vitamin D levels are adequate at 30. I think we need to get it a little higher than that. But you were actually below the cutoff. So you definitely needed supplementation. So I decided to do a D3 with K2 and just an oral pill that you take every day.
So the vitamin D3 that you gave me is the tiniest little thing. It was the easiest one of the few that you gave me. We'll get into a couple of the other ones maybe at the end. But you were very clear, listen, your vitamin D isn't just low, meaning low normal. It's actually low underneath the cutoff, which is really interesting because in some of our other podcasts we talk about, well, sometimes we want to treat with low normal because we don't want to wait till we're after a cutoff because usually that signifies things that could be in your future that are problematic, right? So this whole idea of like a broad-based population's normal needs to be adjusted where there's kind of like what we want you to have. This is considered maybe acceptable, maybe a deviation. But then there's this like number that like really signals treatment.
Yeah, optimal. We wanted to get you to those optimal levels.
So for those of you that don't know, maybe that are listening and not watching, I'm 6'5", I'm 235 pounds, and that's like being generous to myself a little bit. So I'm a big guy. I like to eat.
And you're out in the sun.
And I'm out in the sun a lot. If you're watching a black and white, I'm dark, for a Caucasian, I guess. But in the end, I like to be in the sun. And so this idea of like not enough sun, not enough food was not correct. My vitamin D levels, by the way, had been checked in the past, never to have a problem. In the past, never did I have a problem in the past. Now all of a sudden I have a problem, and you and I basically think I just turned 60, and it's possible that we also found a little bit of a microbiome, so my gut bacteria was a little bit different, and maybe that was related to age or maybe an antibiotic that I had to take during a dental procedure or something like that. But I was not absorbing in the food that I was eating, which is extensive, enough vitamin D.
Yeah. So we replace it.
Well, it's easier said than done. So yes, I started to replace it. So then comes the question, and many listeners are like, okay, great. You replace it like how long? Is that for life?
Well, that's why we check. So we make sure that you're getting to that proper level, and then we can start to ease off a little bit and just kind of keep monitoring the level to make sure that you stay where you're supposed to. And some people do have to take vitamin D for long periods of time. They just don't absorb it well from either the foods they're eating or Just they're not making it when they go out in the sun.
Well, I felt different after a period. I did take the probiotics that you gave me, which is a specific type based on the biotics or the bacteria that were in my gut that were not
there,
not enough of.
Yeah.
So you suggested I take those. I did. My feeling is we haven't retested me, and we will, and we'll go through that on the podcast. But just like, again, two doctors at a doctor's lounge. First of all, thank you for checking the microbiome so that I knew that the bacteria in my gut, which control the amount of nutrition that I get into my system to some degree. And we've changed that. I believe that's going to change my vitamin D levels. Certainly the supplementation kind of ramped me up.
Yeah.
And then you also got me on a multivitamin, which there's been recent studies that have been pretty clear that they extend longevity. And you gave me a proper multivitamin. So it's almost like, you filled up the tank and then the supplementation is a multivitamin, particularly after an age where your absorption might be a little bit less. It happened to also be intermittent fasting on a 16 hours, in an 8-hour eating window. So it is very possible that now all I need is the multivitamin, correct?
Because it's very hard to kind of see what your diet. I mean, you have to eat a pretty varied diet to get all the little nutrients and everything. So sometimes supplementation is just easier, especially if you're not eating that much.
Yeah. Yeah, I've heard people say, well, you have to have all the colors in the rainbow
Exactly.
when you're eating, and that's hard to do.
Yeah.
You're at, you're at a nice, you can't order by colors.
No.
Turns out that's an interesting. There's a business.
Oh, there is.
Have you cut all your colors? So I guess what I'm trying to say to people and to say to you as the doctor in the doctor's lounge, awesome. I took my supplements for a period of time. I did not take them religiously. Sometimes you forgot them because, it's not something you take and you're like, oh, got it. It's like, I know when I missed my coffee, right?
But then that's what for me, that's what it feels like when I do take, when I miss my supplements. I do feel that, I missed something today.
So I can tell you that I didn't know day to day, but I did know over a period of time. And if I had to guess, I think it was the microbiome that allowed me to absorb things better. But the vitamin D, when I took it in a pill, did feel better. But now I feel like I probably don't need it. And then the multivitamin might be for the subtle things that have been shown, again, in evidence-based, because this is a doctor's lounge and we're evidence-based. Yes. So there was evidence that a multivitamin, but you kind of have to get everything tuned up before you can. Because if you just take a multivitamin, you've got a real deficiency, say, in a vitamin D, it's probably not enough.
It's not enough.
Right?
Exactly. Yeah, you definitely wouldn't have enough in just a multivitamin to raise those vitamin D levels again.
Interesting. So that's, I wanted to start off with kind of some of the things that I was doing just to make it relatable to people. So my vitamin D was low. My
folate was low. B12 was low. So yeah, homocysteine was high. So trying to balance those back out again.
Talk to me about B12. Why do you think my B12 might have been low?
Well, again, are you really able to get it from your food? Yeah. Are you absorbing it properly? And then there's a difference between the different types of B12, like which ones the body absorbs better. So giving it to you in this form, I know that you're absorbing it.
We've also known countless patients through the years that are like, I want my B12 shot. And I feel much better after my B12 shot, right?
Yeah.
That's been a phenomenon. Whether it's placebo or not, it's never been fully worked out unless you have a real B12 deficiency, which can happen in certain disease states. But for the large part, like my whole career, there's people coming in for, asking specifically for B12 shots. And that's why I was shocked to see that my B12 was low in a guy that eats well and, does eat a Mediterranean style diet and decent amount of vegetables. But, sometimes those vegetables aren't always organic. How do you don't always know if your cucumber was, so it's It is one of those things regarding the B vitamins, particularly but B12, maybe most, that has really, invaded our culture to be like, I need a shot
energy.
and it'll be better.
Yeah.
But not, I need a shot every day or week and I'll be better. I need it periodically. So maybe it is this rhythm within our microbiome that when you're kind of regular and everything's really feeling good, you're absorbing better. And as you age and you're maybe a little less regular.
Yeah. Well, they know that the diversity of your microbiome kind of decreases with age. So could that be part of it?
Yeah, I would think it. For me, it was because I didn't change anything. I just got an extra candle on my birthday, and I was like, I feel something's different.
Yeah.
So, well, that's super, super interesting. So homocysteine, so go ahead. My folic acid level was low, B12 was low, so therefore you ordered me
those extra supplements. So besides what's in the multivitamin, you got an extra dose, let's say, of the B12 and folate to get your levels up, and then at some point we'll stop that,
right,
and just continue on the multivitamin.
I got to be honest, I kind of have already kind of stopped it. And
Okay.
I've been really good about the multivitamin. It's a big, it's a pill, and the other ones are like, how many of these little pills are you going to take?
Yeah.
That don't make me feel any different, but the cumulative amount does. So you're like, well, which one is it? Like, for instance, magnesium. You gave me magnesium because I hadn't been sleeping well around the time where I thought maybe my microbiome was off. So you gave me magnesium.
Well, because your magnesium was also on the lower side. It wasn't at that optimal level.
Right.
And you're very active.
Yeah. So I did feel like maybe I felt a little bit better while I was sleeping. I felt maybe a little less overall. I felt like almost my muscles felt a little smoother. But in the end, I took I think it was 240 milligrams. But I didn't feel like I needed to take it every day. So I kind of stopped taking it. It's almost like a potassium pill. Like, it is a sort of.
Still, yeah.
So I felt like I kind of upped it, and then whatever I'm getting in the multivitamins was probably fine. So like I went from a stack of having 8 supplements or pills. Some of them had 2 of them in there. So maybe 6 supplements with a couple of 2 versus
just taking
a multivitamin, and I
yeah.
feel good, and my microbiome got, like, for instance, the probiotics. How long do you typically prescribe probiotics?
Well, it depends, because so when we retest you, then we can see what changed, and then maybe it altered into a different way so that we need different probiotics, because you're not eating a lot of probiotic foods.
Right.
But if you were telling me that you're like eating kimchi every day and I'm eating, sauerkraut and yogurt and
I did add Greek yogurt almost
okay.
every other day now.
Okay. All right.
But not kimchi,
But it's not
and not sauerkraut. Yeah.
There's like a little bit of fermented
Yes.
foods, but not a lot.
Yeah. The data on Greek yogurt's so inescapable that I've tried to add that as much as possible. Actually, my mother gave me a great recipe once where you take one of those like leek soups, like powdered leek soup that you would add to water, and you put that in the yogurt, into the Greek yogurt.
It tastes.
The taste is amazing. It's like a dip, but you can like eat it with a spoon or with some
Cucumbers
vegetables, whatever.
or
So good. Could eat that a lot. My wife recently has started adding Greek yogurt to like our snacks with some overnight oats.
Oh yeah.
Kind of an interesting. So there's these like ways of getting the Greek yogurts. Now the kimchi and the sauerkraut, little harder to get correct. Oh my God! When I was in Germany last year, the sauerkraut in Germany is so good.
So different,
God,
right?
So good. All right. So those are my particular scenarios when it came to multivitamins, and I thank you, and I feel terrific. And sleep is really, back to normal. And I feel pretty blessed that way. So thanks. What I want to save for next podcast is probably a supplement that borders on a vitamin, but it's creatine.
Yeah.
And it's getting so much great interest both from men and women, and for so many different things that maybe next week we'll do a full creatine thing. So those of us that are, those are the people that are listening, get everybody to listen to next. We're going to do a really good job on creatine next week because there's so much new, great information and a lot of old information that's useful. So it seems to
not
be...
just for bodybuilders anymore.
No, it's not. It seems to be for,
everybody.
I've heard of, energy and memory and the list goes on and the data starting to accumulate. And then it gets down to dosing and everything else. So we'll talk about creatine.
Okay.
So if people have the ability to, make some comments, I want to see if everyone wants to know, maybe even specific questions about what people might want us to cover regarding creatine at the doctor's lounge.
Yes.
All right. So it's funny. Someone said, why didn't you just call the podcast the Doctor's Lounge? Because there is one.
Okay. Oh, that's why. Okay.
So Soffer Longevity thing covers most things and that we're at the Doctor's Lounge talking about it. So, all right. So another interesting thing happened in the news I want to hear your thoughts on, and that's Kyle Busch. So Kyle Busch is, for those who don't know, is a famous race car driver, NASCAR driver, and was doing well, actually had done very well in a race, is known to be one of the top guys. I consider them athletes. Most people do. It's a very, very hard on your body kind of thing. And he called in and said, I'm not feeling well. I need a shot. No one knows exactly what the shot was.
Yeah.
But then he kept on working. And a few days later, I believe, he died of what appears to have been sepsis that was preceded by a pneumonia that was probably preceded by a sinusitis. So, that's scary because it seems like the world's worst cold that somebody died from in an athlete that's well monitored. So the things I want to, let's first of all start with, well, first of all, what do you think about that?
Well, the question is how much was he pushing himself? Was he getting more short of breath but not saying or maybe telling people, but he needs to do this race.
He didn't seek medical advice in time. You and I know that we've treated 1 million sinusitis, a million even pneumonias.
Yes.
And people get to us and we're like, okay, we've got ways of treating that. We typically, those things are with antibiotics when they get to that level.
And then even admitting them, and then they need IV antibiotics if they're really bad. So you kind of judge, can they be treated outpatient? Or do they need inpatient treatment? But if they don't come, then it's hard to make that decision.
So to me, it really brought out one thing, which is how fragile, particularly the bloodstream can be. And I say the bloodstream because he died of a bloodstream disease, but he was also asking for a shot. I don't know if he got it. I don't know what kind of shots he was getting. The internet suspicion is, and this, I have no verification of this, but the suspicion is it may have been a corticosteroid. So when people take those types of steroids, so the what are called catabolic steroids, not the ones for bodybuilders, but the ones that take away inflammation, right? They stop your mechanisms that are supposed to be, fighting viruses and fighting disease. They stop them, and it makes your inflammation feel a little bit better, but at what risk?
Yeah. As those bacteria will start to, there's no system to protect you from them.
You've messed the delicate balance of the body. Now, typically, if you don't have an active infection, it's no big deal. The body will come back, the T cells will realign, and you'll be fine. But in the middle of an active infection, it can actually be, like this case, deadly. If this is the shot he was getting, no one knows if that was the shot, or was it a shot of B12 or something like that. Just he had been taking that was him saying basically, I need a shot. I think it was the conversation between him and a PA that was like a concierge PA working for the, I guess maybe NASCAR.
Was he driving
team.
at the at
yeah,
that
when
point?
He said that, yeah,
he was driving.
and it was his mind. I need this, and it goes back to what we're trying to do, which is really to, as best as possible, show how doctors really talk, and not how they keep calling them gym bros, which like the Joe Rogans or really some talented people, but people that aren't necessarily experienced in treating patients. And we don't really have many magic bullets. We have clinical acumen. We have like, you know what? I have a really good feeling about this because I've seen 1,000 people like that during my training in the last, few weeks or whatever. And because we all remember our last, but whatever, I have this like experience. I see a human. I'm doing my own like AI processing or HI, human intelligence processing. And it reminds me of something in specific. And that's my gut, which may be my vagus nerve talking to my brain because there's a reaction of all of the cells in my body going, this person needs that. And
sometimes you just have a feeling. You're like, something just doesn't feel right.
Right. But that feeling comes with, I know you did a lot of years of education, which included, family practice in Yale and, the functional medicine stuff. I did all my cardiovascular training, internal medicine, and then, ongoing training throughout that. So 20 years of studying, 20 years of being around people and having people judge how my judgment is, you as well. So when it comes to a split decision on something like that, it's pretty good. It's not good for the patient to come in and go, you know what, give me my BP 157 that we haven't investigated that, it's an anti-inflammatory, but it's turning off something in your body that your body might need.
Yeah. Would you give that for an active infection? Probably not.
Right. So I think the take-home thing for folks is, and we see this, don't come in asking for a thing. Let the trust in the doctor to a degree. First, verify, right? Make sure the doctor has the proper credentials, proper experience. Then hear what they say. Then maybe if you want to say, hey, doc, I saw on TV that, Keytruda, which is a chemotherapy, might be
helpful.
Might be good for us, because the commercial showed that people were, climbing up a mountain. Okay, that's fine. That's where you can talk with your doctor about like they're telling you to do. But you have to talk with someone that you trust that can then synthesize all this information and then give you the right answer. I know we want to be able to go online and go to, ChatGPT and figure it out.
But sometimes it's wrong. Sometimes it does give you the wrong advice.
And for sure, something went wrong that killed this very wealthy, very successful, super athlete, beloved guy. He asked for a shot, and it was probably the wrong shot. And we do not want to be shooting ourselves up with things we don't know. And that's what I'm very against, particularly these quote unquote, unregulated, unstudied peptides without advice from a really caring clinician like yourself that really takes it seriously and synthesizes it into a booklet.
Like, why are we using it? And, the risks and benefits. And I think that's the biggest thing is that everything is risks and benefits.
Right. Now, I said into a booklet because it was kind of weird because the booklet's right here that I like. This one by in fairness, one of our sponsors, Longevity AI, that basically keeps a record of all the things that you're doing. I have it also and usually use the app form. But using that element of continual synthesis of what makes up you, because let's say we have 1,000 points that can be kind of go up and down, whether it's vitamin D, vitamin B, your protein, your T cells. You move one, and there's usually an equal and opposite reaction somewhere else. And if the person doing it isn't aware of that, these deadly kind of things can happen. So unfortunately, Kyle Busch maybe at the very least is teaching us all that you just can't ask for a shot. You have to know what that's about, and make sure that you get a clinician that is schooled in these things. So that's why I found you. So keeping me going. So that was the kind of the Kyle Busch part of what I wanted to talk about. We have a couple of other things, if we've covered that came out in the internet-osphere that I thought was really cool. One was this idea of inflammaging. We've talked about that, you and I, but it's getting a lot of talk. So I think the most important thing is it turns out that the immune-related phenomenons. So how your body is turning off cancers and viruses by attacking them via our immune system, basically controlled by the thymus.
Yeah.
And that is probably the least recognized, maybe the most underappreciated tissue in the body, the thymus gland.
Nobody thinks about it. Right?
Nobody thinks about the thymus gland. We didn't get much information about it when we
just know that it's there.
It's there. And the thymus gland really is kind of the conductor of the immune system. And it turns out that immune system is supposed to do a couple of things. I'm going to just, again, we're at the doctor's lounge. There are three things that really control most of the death in the world today. Cardiovascular death, number one. Cancer death, kind of number two, kind of is number two. And then neurodegenerative disease is number three. So the Alzheimer's and the cognitive impairment, Parkinson's. So it turns out that I think they're all part of a push-pull, not just this idea of inflammaging, it suggests that, for instance, atherosclerosis or heart disease is your body seeing problems in the circulation and sending immune cells to try and stop it in the form of atherosclerosis. Very similar to the body having little cancer genes turning on, or little cancer, oncotic cells, cells that could be precancerous, turning on, and the body turning them off. Coming with, thymus-regulated immune cells to turn off. It's what they're there for. They're supposed to suppress these sort of DNAs that go a little crazy, and they're supposed to turn them off and get rid of them. And that process is very important. It unfortunately can be overregulated and do more of that than it should, and therefore you get growing atherosclerosis, or it's hitting the walls of the circulatory system. It could be hitting the walls of the neurocirculatory system or the brain. It could go out of whack, and that's when
get your autoimmune diseases.
Get your autoimmune disease going as well. So the flip side of that is, if it doesn't work well enough, then the cancers proliferate. When it stops working, the cancers proliferate. The infections can kill you. So that push-pull explains, A, why we have these three major disorders, and then why inflammaging, or the inflammatory rate, seems to change as we get older. We start talking about these senescent cells and cells that are now being discovered that our immune rate is actually what is the marker for aging for us. And as our immune system over time turns down, we age faster. And therefore we can get a clock that says your immune system's turning down faster than you're aging. You better do something about it, because you're aging faster, or your immune system's great and you're aging slower. So this idea of inflammaging can be looked at with blood tests, like CRP, the most common one. There's a few other ones, but chronic reactive protein, C-reactive protein, is a marker of the inflammation that starts to get out of whack. And we have medications now that can put it back in whack, so that our aging is, our biologic age and our inflammatory age are closer to the same. Did I say that okay? I felt like I maybe went a little awry.
I think that was, that's exactly what we're trying to do, is just decreasing, like at least having your chronological age and biologic age at least the same. You don't want your biologic age to advance your chronologic age.
It's almost like it gets stuck on, like you need to have inflammatory cells. You need to have your immune cells going after your, early cancers in the body that need to be shut off.
Yes.
But if it's turned on too high, then, and this happens to a lot of us, it's called, they call it like a non-infectious inflammation.
They think that some of those senescent cells are actually immune, like causing. So like the body isn't really sure what to do with them. They're supposed to die, but they're not. So they're kind of releasing these small amounts of inflammatory cells.
Right. So in the doctor's lounge, we would say, well, we got to all check a CRP, because if we're inflaming, if our body is telling us that it's aging too fast because of a systemic inflammation, that doesn't mean that, like, I have a shoulder that hurts me and my CRP is up. It means that you have general increased CRP, and that this part of your body that was designed to work perfectly is now overworking, and we have to figure out ways of getting it back to normal. And there are drugs, like a very old one called colchicine, which was considered to be a nuisance generic, and now it's becoming mainstream in cardiology
to decrease that inflammation.
Yes. And I actually had a very, very good friend that had his heart sac became inflamed from a virus, and he took colchicine, and it took all of it away. He was actually hospitalized because he got fluid around the heart. Took the colchicine as part of his treatment, went completely away. So it regulated his inflammatory system that his thymus wasn't doing, I guess, good enough a job at 60. As like a fourth grade friend of mine that grew up together. And it reduced the inflammatory process, took away the water around his heart, and he is a perfect today. So that was specific to one organ, but imagine that in the brain, imagine that in other places. So it looks like that this inflammaging is going to be something we talk more and more about as our new kind of longevity clock. That there's a few clocks. Like people will talk about biologic clocks way too much. There's this, people say, well, you're biologic. You're 60 years old, but your body is 55 or 70 or whatever. And the truth of the matter is, I don't think we can do it towards the body. We can do it towards an organ.
And yes. That's why the testing, when you get that, like the true age, you get it back, it's per system, not necessarily overall.
Right. They can do an overall, but that's kind of like a mishmash. It's really like, and really what you care about mostly is your heart and your brain, because if those two are older than you want, it doesn't really matter what most other organs are. I mean, there are some cases when one could talk about, say, a kidney or something that's very, very important, the liver. But really, those two, you got to make sure that they are younger than your stated age if you want to achieve longevity, correct?
Yes, correct. And the immune system, we'll add that one too, because that's an important one.
What was the test you said that?
The true age.
Tell me about the true age again.
So
I know I got it.
Yes. So it's
different
just
when it's you,
It's the different clocks that they measure out. So it's just that blood test, and we'll have to bring up the report.
Bring the report. I think maybe we'll do it next week with the true age and the creatine. I think those will be two good things if people clamor for it a little bit. So that's kind of the inflammaging situation. I heard a kind of cool thing from Eric Topol, who is one of the best cardiologists out there. He's a bit older now. He's the head of the Scripps research department called Translational Institute. And he was talking about the incredible importance of the way we're going to start treating cancer, and the excitement around treating cancer, really using vaccines. So even though there's a lot of anti-vax, and I know RFK gets people consider him anti-vax, and maybe he is, I don't know him personally. But I will tell you that the data on vaccines for cancer and the idea that we are going to basically be able to find out the specifics of a vaccine, solid or blood. It can be a solid tumor or it could be a blood tumor. That learning what they are and vaccinating against them, because they have signals on them that we can get very specific antibodies towards.
And then that's your immune system going after them.
That's your immune system. So that's why I wanted to talk about it. But it did actually, he just produced something recently that was amazing on the various pipelines of vaccines that are out there for cancers. Why does a pancreatic cancer, no one wants that, but why does one person get it out of the blue? And we know there's some genetic reasons, we know there's some environmental reasons, but we also know that what it looks like really early can be potentially vaccinated against.
And that would be absolutely amazing.
Yeah. And using that same technology to treat it once it was there as well, because it's the same idea. Obviously, you want to have the vaccine so it never happens, but you also want to be able to treat it with your immune system, charged up immune system. So basically, you're charging up the immune system that has always been keeping it at bay, and you can charge it up by learning more about it. So that's a really new, cool thing. Like, I think we want to keep our eye on that has to do with this very delicate balance between too much immune system, too little immune system, like we saw with Kyle Busch, I think, and just the right, like the Goldilocks of immunity, you know, starting at the thymus gland, which we can really, there are great tests to check for that. So these these new cancer-related immunologic treatments are amazing. It's funny, I have a colleague that I work with, I'll mention his name because he did something really terrific. His name is Eliav Bar, and he was one of the first guys. He works now for Merck. I think he's the chief medical officer for Merck as a doctor. His father's a cardiologist. I know the family. But the bottom line is, I know he was at one point in line for a Nobel Prize. I don't know if he still is or not, how that works. But he was the guy that put in motion and made happen through Merck a treatment for a cancer called cervical cancer that was not what we thought it would be. It wasn't a resection. It wasn't chemotherapy. It was actually the human papilloma virus vaccine.
That's okay.
Human papilloma virus correlated to being an increased risk for cancer in the cervix. So he made really Gardasil. And Gardasil is for all young girls so that they don't get the sexually transmitted virus that could then predispose so many of them to cervical cancer because of the immune system situation. So it led the way for so much of this other research. It's not exactly the same, but that was the first time it was used in our medical system.
That's, yeah.
Do you have experience with, I mean, I know you were around when this started becoming normalized.
When it was recommended, became one of the recommended vaccines. And I think at the very beginning, we started just like you're supposed to give it to them a year or two before they became sexually active, which was kind of hard to determine when they're going to be sexually active. So then, the age went from like 12 to 11. And I think right now, the guidelines are at 9.
Yeah, because you can turn those on, and then we've greatly improved the rates of cervical cancer. And that's going to happen now with different vaccines in a different mechanism. But it kind of started at least on a population basis with Dr. Barr's perspective and Merck's perspective there. And now we're seeing the dawn of a new age because AI can help it. AI is advancing it in such a way that I think we will have in our lifetime both vaccines to prevent and immunologic treatments for most of the cancers because the body is turning off cancers and it doesn't work periodically. So we're going to use the same body mechanism, specifically the immune system, to fix them. And so that's really cool. And I also appreciate Eric Topol's perspective on it, which I recently watched. If anyone wants to watch it, I think it's a little scientific oriented, but
that's what I like about it.
yeah. No, I think it's more geared towards doctors, but there are a lot of people that love to listen to that, and so he's Eric Topol. All right, so we had decided we were going to also talk a little bit today about the lymphatic system. Maybe you can, because it's getting a lot of attention recently also, and maybe you can give me some of your thoughts on that.
So it's the lymphatic system of the brain, just how it's clearing out all the stuff that really shouldn't be in there. But as you're going about your day, you do build up like different, I wouldn't say toxins, but just, byproducts of metabolism. So then at night, that's when all those things are supposed to be drained. And it mainly goes through the lymphatic system.
Yeah. So I heard some really cool, because I was having a little bit of a sleep problem there for a while, which is right now is gone. It just feels terrific. One of the things I did, I bought one of those cooling beds because my wife doesn't like it quite as cool as I do, and those are I can't speak. They're not a sponsor. I probably should. They're amazing. So I get it exactly where I want it, nice and cool. Also, there are positions that are thought to be better for lymphatic drainage than others. So more side than,
straight
either way. So I think it's a little better for side sleeping, maybe a little bit of head elevation as well. That's the pillow idea, maybe why we use pillows. So that drainage, I know when I've drained. I really do. I can feel it. Now, people say it's more with the deep wave than the REM or the rapid eye movement sleep. That's current wisdom. I'm not a sleep specialist, and there's an entire group of people that's all they do. But I will tell you that the positional things, the environmental things, so cold, no ambient light, the right time the same time every time. And trying to avoid things that get you up and out of bed that will wake up your cortisol and whatnot. And then when
increase your heart rate.
Right, getting your heart rate nice and low. And how do you get your heart rate nice and low? Do not have a full belly. So you got to be, at least 3 hours without food, cold room, same time. Don't get up at night unless you absolutely have to. All these little sleep tricks, which we spend half our life doing or more, are very, very important. We talk about it almost every couple of episodes because it just gets more and more interesting. But draining the body of all of those bad waste elements.
There,
listen, as a cardiovascular specialist, I see a lot of waste elements in the venous and the lymphatic system, and I see what happens when those don't get drained and how bad, say, for instance, the leg looks. And imagine that's a gravitational issue. So we see these like brown legs that you've seen, right? So these brown legs are because of gravity, and there is an absence of drainage from the legs. And look what happens. Everything is brown and mucky and ulcerous and terrible. Well, imagine if you're not draining from the brain.
You're not going to get that same look.
Exactly.
But what is being deposited that should be.
See it from the outside, but from the inside, and that is I think the essence of mild cognitive impairment all the way through the various neurodegenerative diseases like Alzheimer's, for instance. So those issues, that buildup of gunk in the brain has to be fixed mostly by sleep. And the proper sleep and the proper amount of time, 7+ hours, the deep wave sleep, all the things that we can track and improve and talk with a functional medicine specialist like you that can go through the many things that you went through with me to get kind of my sleep back to where it needed to be, and where I feel
like you wake up rested.
And you kind of know.
Yes, you definitely know.
And I've had a lot of experience with sleep deprivation through the on-call years that were a decade in the making as a cardiologist, and learned ways around it. But ultimately, nothing beats restful sleep. And I think, a functional medicine specialist with your bag of tricks, which include understanding the supplement deficiencies or the vitamin and nutrient deficiencies, augmenting for that, getting the timing right of the eating and the exercise and the type of exercise and the environmental issues in and around your day. Like you do all of those things and you still need something, well, then you send out to the proper specialists. But
like we do still send them out for, their sleep testing for, sleep apnea and all that. So,
yeah. So this is really great stuff that you do, since 90% of it seems to be in that functional medicine world. And then there's a 10% that you're able to tease out, and what do they say? It's not the great doctor's not the one who can see the 99 out of 100 that have the problem. It's the one who can take the 1 in 100 who you might have missed. So you're out there removing all of the typical stuff and then knowing when to call when there's something. And that's why working together is great here in our individual practice. But it's the way that so many doctors are starting to do now across the country. They're adding these, preventive wellness, anti-aging, longevity, whatever you want to call it.
Yeah, I think they're looking more at a wellness model instead of waiting until you have a disease, giving it a label, and then going from there.
Yeah, and that's what we're trying to get everyone to hear about, because at the Doctor's Lounge here, that's what we want, right? We don't want to treat the disease once it's happening. We both want to prevent it. What do we know amongst our colleagues and friends and reading that helps us to do it? So that's the goal of today, and really every segment that we'll have, whether it's just you and I, or when we bring when we had our producer here last week, sort of the man on the street, or whether we had the CEO of a major longevity company like we had a couple of weeks ago, and the various experts that will be upcoming. So hopefully people will be able to stay with us and listen to our points of view and build our audience so that we can continue to reach people and get them sort of the latest and greatest that we're trying to stay on top of.
That sounds great.
All right. So with that, I want to again thank everybody for joining us today on the Soffer Longevity Podcast with my special guest and co-host, Dr. Safa Maklad, who has helped me bring all of the combination of sort of wellness functional medicine all the way through traditional reactive medicine and put it all together in a way that kind of makes sense. I wanted to also thank our sponsor, Longevity AI, again, and their data aggregation, their medical record system that allows us to really keep everything straight. And I want to invite everybody to subscribe below and see us with our next segment next week. Thank you all so much.